Good afternoon. January is Cervical Cancer Screening Month. Joining us live to talk about the importance of being screened is Dr. Ken Baker, Chief of Obstetrics and Gynecology at St. Peter's Hospital. Good afternoon, Dr. Baker.
Good afternoon.
Let's start with the basics. What is cervical cancer, and are there any signs or symptoms?
Sure. Cervical cancer is an abnormal growth of the uterine cervix. This is the part of the uterus that is in the vagina. The cervical cancer is actually a viral infection where the virus infects the normal cells of the cervix and subsequently causes abnormal growth, and at some point would cause a tumor if it was allowed to grow.
What about any signs or symptoms that a woman would experience?
Signs and symptoms of cervical cancer can be abnormal bleeding. It can be bleeding after sexual activity, abnormal discharge from the vagina. Advanced symptoms would be swelling in the lower extremities, pressure-like symptoms in the pelvis, or abnormalities of urination, possibly.
Cervical cancer is one of the most preventable cancers in women. Can you tell us a little bit about more why that is?
Yes, cervical cancer prevention is able to be done because we can screen for cervical cancer. And the way we screen for cervical cancer is the routine Pap test. Pap test was identified many years ago where the sample of cells from the cervix is taken and then looked at under a microscope for abnormalities. Many years ago when this was done, it was seen that these abnormalities could be detected and then removed before they could cause a cancer. So there are what we call precursor lesions that can be identified prior to cancer, and then these can be treated in such a way as to remove them or prevent cancer from occurring.
A new study that just came out recently finds that too few women in America are being screened for cervical cancer. Why is this, and what can be done to encourage more women to get screened?
Right. I think one of the main reasons that too few women are being screened for cervical cancer is the Pap smear has done such a great job in reducing the number of cases of cervical cancer that it's not on the public mind or the public forefront. Many women don't realize that cervical cancer can still be deadly if you do happen to get cervical cancer. There was only 12,000 cases in the United States per year, causing only 4,000 deaths. Therefore, I think that the public needs to be more aware that this is a highly preventable disease, and they need to just see a gynecologist and some primary care providers to have their Pap smear done regularly, and that these precursor lesions can be treated and prevent cervical cancer.
Talking about prevention, what are some of the ways that women can prevent cervical cancer?
Because cervical cancer is caused by a virus, the cancer can be prevented by a vaccination. There's a new vaccination out called the human papillomavirus vaccine. There are 2 or 3 types available and approved by the FDA right now. They take into account the types of HPV that are identified, and they can prevent a woman and men from having HPV-caused cancers, not only of the cervix but of other parts of the body. So the vaccine is given to humans of the age of 9 to 26, men and women alike. That's why I use the term humans, and it will absolutely reduce the risk of cervical cancer and other cancers.
When should a woman start being screened for cervical cancer, and how often?
The current guidelines for screening for cervical cancer are at age 21 for all women, and every 3 years between the ages of 21 and 30. After age 30, it is recommended that women are screened every 5 years with the Pap test, which looks at the cells from the cervix, as well as a test for the HPV virus, which can be detected in the same sample that is taken for the Pap smear.
And you mentioned this briefly. Who does the screening for cervical cancer?
Right. Gynecologists are trained to do Pap smears, as well as some primary care physicians. So any of those physicians or nurse practitioners, physician's assistants also do screening for cervical cancer, and can be done basically at any medical office.
Great. Thank you so much, Dr. Baker, for taking the time to discuss cervical cancer screenings. We appreciate it.
You're welcome.